together. We have, thankfully, a lovely parent and a school provider that are navigating two different worlds right now within the early childhood and younger student world. So our mom, Paula, if you want to come and introduce yourself and share who you are and why you're here to speak, or why you thought you would have a good voice for us here as a parent with a younger child.
Hi, I'm Paola. So I'm a mom of Donnie Baker and Rosie Baker, who were just recently diagnosed with autism almost a year ago. So it's been a new process for us, but I'm learning, and here we are day by day.
So Paula will be helping share an experience of moving into school, right? Your students are, or your children are not in school yet, but you're navigating the medical world right now and moving into an educational one. And with us as well is Mary Zimmerman. If you can pop on and give us a little bit about yourself.
Sure, I'm Mary Zimmerman. I'm the 4K through first grade principal in Ellsworth, and I am the special education director for the district. So the goal of connecting with you guys today is that we have a very recent partnership with Ignite and Dr. Paulson. Recent as in like after the new year. So just learning what that can be, and it's not new for us to necessarily have services in school, but just looking to, like you guys have referenced, really build more of that relationship and have a really clear understanding from the beginning, and just learn from, times in the past where maybe we didn't do that on the front end. So that's where we're at right now, just working with 2 students, but taking that time on the front end to really make sure everybody's, working towards the same goals.
Awesome. So we'll start with Mom. I was hoping maybe you could talk about how collaborating and some of the boundaries as coming from family, working with providers and people coming at you with all this different information. What are some of the things that worked well with setting boundaries and the collaboration that you're seeing and navigating the pre-schooling age and the medical and therapy pieces within getting a diagnosis or just entering into a diagnosis?
Hi, yeah, so it's been quite of a challenge as of right now. I feel like I personally like to keep an open mind. I don't want somebody to feel like they can't come to me because they might be scared I'm gonna attack. But yeah, no, I love any feedback from anybody. It's just kind of a challenge on my part because I do have different specialists that my son sees, or he has his therapist that he sees as well. And it's just different ideas coming at me saying it's my choice. What's his next step? And it's like I'm learning as well. This is a new process for me. I want what's best for him. So I have to take all those ideas into consideration and work from there. But pretty much communication is key. I want to hear from everybody and what they have to say, what's their reasoning behind everything, what's their motive, and I'm open for that. But it has been quite of a challenge so far.
Yeah. Can you tell me a little bit more about those challenges, like the barriers that you see in either the communication or what's making that communication not happen in the way that's flowing?
No, yeah. So as of now, we're still in this pandemic dealing with COVID. It's kind of getting easier, but then we have those spikes and it just brings us all back down. But I feel like physically, I can't engage as much as I would want to. Everything's virtual now, so we do have to schedule meetings every other week or so. But by then, I feel like I have a million other things going on. Sometimes I forget to bring up these issues that were just happening. So we lose that type of communication. So as far as ABA goes, I physically cannot walk in the building to drop off the kids. So I feel like we don't really have much FaceTime going on. So it's just kind of a hi and bye, how are you kind of situation. I wish we could interact a little bit more. That's been challenging.
Oh, thank you for that. And Mary, from your perspective, working with providers coming into the building and that communication and the respectful boundaries, can you tell us more about the successes with communication that you've had with Ignite, the private company, but also what are some of the ways you guys have those respectful boundaries in navigating the two school and private situation?
Well, I think what was most effective in this experience was that conversation before we even started. So, what was our goal for reaching out and strongly encouraging, the family to consider this as, something we could work out to provide right in school and try to make it as workable for them too. So just talking about all that on the front end before we even started, and then knowing that once it got going, there would be questions and differences in, what are the goals of ABA is often connected to what we want for that child as far as, expected behavior, ability to, accept and follow direction, positive interaction with peers. So we often find that our goals are very similar, but it just takes that almost daily check-in. And kind of infusing the support into the classroom makes that easier. Sometimes if you have a scenario where the child's very separate, the ABA is taking place somewhere else, that can be more challenging. But we've also had cases where it did need to take place somewhere else because that's what was best for the student at the time.
Yeah. I see that Andy has joined us. So the question I'm gonna flip to you, because I know when we prep for this, you were talking a lot about the boundaries and like where that IEP ends and where services start and how you navigate who's doing what and where and how. Could you speak a little bit on that?
Absolutely. I mean, Mary set me up perfectly for that question. I think part of it is just really having really ongoing conversations and trying to reduce jargon. I think sometimes, special education has its own terminology, its own way of describing challenges, behaviors, and interventions. The autism or ABA provider or mental health provider, we have our own set of jargon and ways of describing it, but having a real-time conversation with a real kiddo right in front of you and describing what does this child need to really be. I mean, I come in from Ignite's perspective, and when I talk with Mary and the team at Ellsworth, it's how can we help allow this child to be better engaged in meeting those IEP goals. So I see our role as really enhancing the opportunities that child has to take advantage of learning. And so we're really working collaboratively there. And I think the other piece that we really want to do is that we're there to work ourselves out of a job, so to speak. We're not there for the long haul or long term. We really want to come in and provide the kinds of supports and equip that child, that family, and that school to really take it from there. So it's really this a true collaboration. And I'm just repeating what Mary said. It really starts with lots of conversation, and then when there is a misinterpretations or we're stepping on each other's turf, being able to have the ability to kind of step back and go, hey, what's going on here, and do that corrective action ongoing.
I love that you mentioned the jargon. I like to talk about is we all have our own language depending on our experiences and who and what we're representing in the conversation we're having, right? So we all have family language, we all have our work language, and even within our workspaces we have different types of language that comes across. So I love that you mentioned that that communication isn't just about showing up, but it's actually navigating how we talk. And it's, it's not about simplifying things. It's about making sure that the language pieces are understood by all. Because it's not about concept. It might be just about how we're saying it, or especially in education, the acronyms we use, right? And remembering that not every acronyms are the same, which is very interesting. So Paula, I would like to come back to you and ask, within the communication pieces because that seems to be what we keep coming back to, really good communication. And you had mentioned the barrier of not having face to face, and that loss of in Zoom or in meetings like this, we don't have the chatting time, we don't have the relationship building time that we typically have, and I think that's a loss that we're feeling. So within moving in the communication pieces, what are some of your hopes moving forward as we start to hopefully be more in person and be able to get closer, but some of your hopes and what you want to see your providers for your student services have in the communication that they use with you, and how they communicate with you?
I guess really that we understand each other. Another issue that I kind of see going on right now is, so my son Donnie, he currently has his speech, his OT, his physical, apart from his ABA. And then at home, one thing that I see right now is he doesn't really act the same way with everyone. I don't know if it's because he's been with speech and his OT he was maybe 6 months and he's pretty new to the ABA environment. He does some things with them that he doesn't do with the others. So I feel like we don't really understand when here I am telling ABA, oh, well, Donnie at home, he wears his glasses all the time. He doesn't give me any issues. And they're just like, no, we don't see that. It's not really something that I feel is going on. So I feel like understanding each other. I know right now it is kind of hard because they're not seeing it, but just keep that communication open and work together to maintain the same goals and just to help each other out.
Yeah, when I hear a little bit of trust and understanding.
Yes.
Well, right. Because everybody's experience with somebody is going to be different. And so knowing that what you hear from others is important, and all that information creates a whole child picture. So thank you for sharing that, because I think that's a very common experience, especially when we have very separate situations that we see children in. And it's very easy to go back and say, well, I've never seen it. Like, so it can't be real, right? Knowing that every voice is equal in understanding that whole child. And so everybody is an expert in a different way, that all those pieces should be heard and are very valid. So thank you for that, because I think that's a very common piece between providers and parents and families. So I want to ask, because Paul, you kind of alluded to the fact you just started with your ABA, and it sounds like your children go to a clinic instead of having them inside the home. And the providers we have with us today with School and Ignite are doing it within school. Can you, Mary and Andy, can you guys explain a little bit of how that looks and sounds? What it actually looks like for the student, receiving services within the school. How are they navigating the world between School and Ignite being together inside one building working?
Well, in one of our cases, it is school and some in home. So we have, more cross, communication. What is really critical in that scenario is the ongoing progress reports. So, we would never want more than a month to go by without an update to parents, an update to the team. What are the goals? Are we all still looking at the same goals? Or somebody might say, boy, I think we're off here. Let's regroup. Because a month in the big picture doesn't sound like a really long time, but it can feel like a long time to go without any kind of update of, well, how is this going? Is this working? How much school has the child missed for all kinds of reasons, especially in this day and time. So, but at school, it has varied from a longer block of time where the child's really incorporated into both the gen ed and special education classroom, and some individual time, to another student that has a short amount of time physically at school, where they work, almost one-on-one with the student. And then we have added some center-based time outside of school for that student. So it's just helpful to remind everybody, like, this doesn't have to look the same for any student. We have to look at what that child needs and what parents are comfortable with. But it's always with the goal of getting them the max amount of services. And in our world for school, because we know kids, just like any human being, responds differently depending on the environment that they're in. We want to get them in a place where they can gain the most from school, that they're in a state to be able to learn the most. That's our role in this. That's what we want for them. So I'm not sure if that answers your question.
No, and I think that's perfect. And I think the model I often use is, I call it a week in the life of the child. And so we literally just map out, like, and it's child focused and child centered, and just like, where's that child spending their time at school? Who's interacting with them? We want to maximize the relationships they have and not just keep adding adults. So we want to kind of look at the quality of those relationships, take a look at across not only the school day, but home as well. I'm glad that was mentioned, that we really do want to, if possible, extend what we're doing at school into community and home settings as well. But that week in the life of a child seems to be, for me, a nice anchor that we can then go to what Mary was talking about, and just kind of taking a look at where are things working well, what are the goals that we're relying on there, and maybe areas where it's too much. We have too many adults, or there's just too many cooks in the kitchen, so to speak, for that kiddo. And so it's just having an open mind and an open discussion about that to really make it work. And I think the other piece I would add is that the reason I love this model is it really takes advantage of natural environments at its utmost place, in terms of just really, rather than that's, I think, Paula, you were kind of mentioning that, I think you were, and if I put words in your mouth, I apologize, but that silo effect that can happen, where the kid is going to therapy here, therapy there, therapy, and so there's all of a sudden there's all these different siloed approaches. And I think what we're attempting to do, even though it's sometimes messy, is really create a model that is much more integrated and less siloed and more naturalistic. And I think that's the underneath goal that I think makes the most sense for kids.
Well, thank you for that. My next big question, and I'll start with you, Andy, and then we'll go Mary and Paul. What has been the biggest barrier, and how have you broken it down in working with Andy and Mary with school, with home, and then Paula with home and organizations you're working with? So we'll start with you, Andy.
I think for me, I've been around a while, so I've kind of tracked autism interventions from the late 90s to now. And I think that there's kind of a history of tension between schools and providers. And that comes from an honest place. And so I think part of it is just being able to kind of look at that tension, and I think Mary addressed it a little bit, we've all talked about it a little bit, but the relationship between the IEP and due process and then the insurance and third-party billing, and kind of where those begin and end, and making sure that we're clear and have clarity there. That's probably one tension point. I think the other piece is just really, particularly, this is where the providers have failed, is coming in as the expert and assuming the sort of expert stance, and that the role that teachers have played or related professionals have played doesn't have value. And I think that's just not the case. And I think we want to learn from each other and really be in this kind of true collaborative way. So those are probably the two areas, is just really mutual respect in terms of what all professions bring to this really, really complex challenge of autism. And then also just recognizing the nature of the governing bodies that support the work we do, whether it be social education, due process, or mental health procedures and processes as well.
Right. Jenny Bibler often says, IDA wasn't written for best practice. So how are we finding our way to show up for the students and the kids in front of us when we have so many logistics that really fight us? And how do we make sure we keep centered to be able to navigate a world in which we can leverage all the things out there in a way that works for student, but in family, right? Because I love that you mentioned the siloing piece. That's a lot. And I think as a provider or as a school, we don't realize, we want to think through our lens, right? We think, well, ours is the most important part, right? We're the key, we're the thing that makes this work. And no, we're a part of a very big system within how it shows up for student and family. And so sometimes sometimes our laws and federal laws don't see it in real action. So I love this experience that you and Ellsworth have with Ignite, because I think you are really navigating through a child's eyes. We did have a question about whether or not you had a resource around your week in a life of students. If you use a template, or if you do it, or is it just an idea thought that you follow?
It's a self-made template that I made for myself. So I'm happy to it's just using a Word doc and kind of putting a calendar up and just mapping it out, but nothing too fancy. But I think it simplifies a bit for me, and I think also is a good framework to keep referring back to. But I'd be happy to share.
Oh, thank you so much. And Mary, what's the biggest barrier from the school perspective that you guys have experienced? And your solution, how you work through it?
Right, and I think it's education for us as well. People feel the pressure to really want that child to grow and do better. They have an anxiety themselves about kind of the plateaus where sometimes we can be. So it's been the education of really the need for patience, because we're talking about changing behavior and it takes time. Whereas everything else in their world is like, well, every 9 weeks we have to show progress. And I just have to be, the solution is just assuring them and really educating people that haven't really studied, it takes time. It takes time to change behavior. And it's okay to just allow for that time and not feel that pressure. That's really been the biggest thing is kind of this, they're excited and then just look for this immediate result. And that's, just not super realistic when we're dealing with changing behavior. So I think once they see that and they see how the therapist works and consults with them and says, hey, this is what I observed in morning meeting this morning. Why don't we go back and really concentrate on that? And they start to see the connections, they come down a little bit and understand that it will take time.
And you keep saying behavior change, and it makes me think some of the things you're mentioning, we're automatically going to think about behavior change in child, but really it's a lot of behavior change in adult.
Both for sure, absolutely.
And how much, Andy kind of alluded to that tension that has been built from in-home therapy to school, and that it was almost like fight for time for child, right? That we're still kind of coming out of and understanding the navigation of an outside service in school. That there takes some trust building, but also flexibility of adult is a huge part of this. And I love that I'm hearing that as an example through your navigation of this kind of service provision. So Paul, I know you've already kind of said some of your barriers. I didn't know if there was another barrier that is coming to mind that you wanted to share and moving into working with other service providers.
I think they pretty much wrapped it up, where it is kind of difficult to go from school and ABA, and then you have all these other things going on, but you want to work with everybody and what they're trying to do with the child. It is something that takes quite a while, behavioral wise, and like you mentioned, in adults as well. So right now I am working full time, so it's hard to manage Donnie's school and his therapy, and then I have work, and then I have to go and I have to explain to Dad what the new plan is, and even grandparents too, anybody really that's involved with the child, because sometimes they're with them, and if I don't explain this is what's going on, this is what we're helping to teach him, it kind of gets lost. He could spend 3-4 hours with Granddad and he doesn't really know the plan that's in place for him. So there's no progress going on there. So I feel like that's really a lot of wasted time there. But it is managing everything and working with everybody. But pretty much, yeah.
And I love and listening to your experiences, how much it just shows and proves that families and parents especially are the experts on their children. And so all of the little pieces that you're describing that, like, oh, grandpa's not there yet, but he'll get there, right? Like all the little pieces that we're hoping will grow, and all the adults around us, that the wealth of knowledge that each of the members of, when you get into school and to our IEP team, it matters a lot, because you don't know what you don't know, and you only experience what you experience. And you've already mentioned how Donnie especially shows up different for different people. And so that whole picture, you've got to have the expert mom or dad or whoever is the expert around that child telling you what's going on, so that we can really navigate all the different pieces together. So thank you, because that kept popping up as you were talking. And don't worry, everybody around you will start to get there. You're the best teacher for them. But I have hope that none of that time will be wasted time, all the time they spend with all their different family members.
Yeah.
All right, so I know those were the only prep questions we had, but I'm hoping you folks will let me ask you a couple other ones. So Andy and Mary, so knowing that we have a lot of barriers within school coming into, in-home therapy coming into schools, and schools adapting to those pieces, knowing that we're trying to show up for kid and show up for family, because when you can get services within a school environment time, we're really shoring up those pieces. What are your biggest hopes moving forward to not only the program you're seeing, but with that collaboration of school and providers? What do you see for the future, and what are your biggest hopes within maybe even just your collaboration?
I can start, Andy. I would just say that it's for our staff collectively to learn from the specialists, the ABA therapists, because honestly, we have people that might have had very little training in behavior. We have many support or special educators on alternative licenses. They possibly have never taught. I mean, it's just a reality of the time that we are in. So for people to understand that, in order for kids to gain their benefit out of, the specialized instruction we can provide for them, we have to get them into that state where they're ready for that. So just observing therapists, learning from them. And again, I think Andy said it earlier, it's not meant either on our end to stop our relationship with them, because every student they work with, it looks different. So we can learn a lot from observing and collaborating with them, take some of their strategies, and then that makes it more consistent for the student, even at the time that the therapist is not here. It doesn't feel like, oh, well, that's done now, and now I have these rules and expectations. We try to have it be more seamless.
Yeah. Oh, I love that. The hope to learn from others, right? That growth from others. Yeah. Mm-hmm. Andy.
I think I would definitely endorse that. I mean, that's clearly a significant goal, both in terms of being able to support the staff at schools, but also just learning from. And so I think that relationship building there is huge. I think the other piece is that this is on the continuum of service delivery, particularly on the spectrum of autism. Creating more access, creating more opportunities for kiddos and families to get services in different parts of our state, in different areas. I think that there's a bit of a movement towards only center-based autism services, and I think that has a place. I'm not saying it doesn't have a place, but just I think that having more breadth in service delivery and creating more opportunities for kids to get high quality service in natural, I said this before, but I'll say it again. I'm a big believer in that natural environment, community-based service model. I think it really holds true for a great opportunity for kids. And I think also and again, I'm just repeating a lot what Mary said and what you mentioned, Katie, is the collective growth that we as adults can experience by doing that kind of a model. And so I'm excited about it. I hope other providers will take that risk and step back in. And I know that more schools are at least curious about it. We're starting to get more interest, and if it isn't the best fit, that's okay too. It's not like it's not a have to. But I think in the right collaborative environments, it can be really, really great opportunity for kids to grow and learn.
I want to go off. Thank you so much, Andy. Go off a comment that was in the chat from James, because I'm trying to think of hopes, right? Because we want to move forward with this hopeful thought. And my hope off of James's comment is that we are not looking in all the different goals and the way we learn from each other, not missing how much we learn from the person that we are there to support, right? That yep, the neurotypical, I would say most providers typically are on the neurotypical side of things versus the neurodiverse, that the neurodiverse path and perspective is where we need to learn as well. That idea that it's only gain our information. Nope, we need to gain information from those who think differently as well. But my hope, James, from your comment, is that we start looking at not fixing, but we start looking at how do we support somebody to be the best them they can be, and that a neurodivergent path is a highly valuable, very cool path. And it doesn't have to be some one path that they take within our structure to be able to be successful. There's so many ways to be successful, and it doesn't have to look like what we have deemed as a path, either through school or through clinical goals or things like that. Bobby, you had your hand up.
Yeah, so Mary, do you mind explaining to me a little more, Andy, as well? I'm excited about the concept of working with the technicians more. I have several students that get supports through that EBA therapy, and I think it's amazing. And I completely agree. We all have things to bring to the table. We know the kids differently, like Mom was bringing up, that, you know what, we all know the child a little bit differently, and it'd be great to collaborate more. So I guess my question is, some of our kiddos on the spectrum, in order to keep them included in the classroom, they have a lot of support throughout the days. And yes, we're trying to have peers help with that, but they need a lot of support. So if a technician is coming in, I guess, how often are they coming in? Is it routinely, weekly, monthly? And if they're coming in weekly, how does that fit into IEPs? Clearly, we have to do, as a special education teacher, I have to do those instructional services. But are they allowed to fulfill then those supplemental aids and services of having an adult support? So is that, I guess, how does that look? I don't know if I made sense.
No, they are not, like how we would consider a school staff being that supplemental support.
No.
Okay. And at times we've had to have the support staff there. It could be a child they're working with that is a runner, and, we always want to respect what their ability is to. If we have to stop that child from physically leaving the building, and need to adults, then we would add the school staff. So we do not include it as an IEP service. We just look at their plan overall to say, we really, as a team, parents, teachers, long-term care worker, everybody that's there, this is what our hopes and goals are. We really believe if we don't work from an ABA perspective, that starts to feel like we're not going to get there. So that conversation is just to add them to the whole picture, but it is not, in our setting, it's not added as an IEP service.
Well, not written in. I'm just saying if they come in and support in the classroom, so clearly that's not instructional services, but Correct. We wouldn't necessarily need to have that adult support from our staff with them because their ABA technician is with them in that classroom setting.
And in most cases, it's just them. Yep.
Okay, and that's what I was going for more. Okay.
Yep, and they're always, what's great about, their training is, they're always looking to grow that amount of time of tolerance and, the child to be successful. And their training just reminds them to do that really sequentially, right? Like we don't just go from 0 to 100, let's make sure they're successful. And that's good for our staff to see too. Like we have to respond to what that child tells us they're ready for. If a couple of people on the team are like, well, they just need to be there, they're telling us through their behavior, they're not ready for that. So we want this to work. And the therapists have been great with sometimes explaining that to parents too, like we want them there too, but they're not ready, and we're going to keep working at it.
How often are they in the school setting? And it's different, but I guess what's the most extreme of having that therapy support in school versus not?
It's been daily, for a set amount of time. Like the one we have right now will end now at the end of our school year. We have another one that is less time at school and more center-based. Originally was all at school, every day at school. We're seeing a lot of success with that child at the center. So long-term, our conversation would always be, how do we get them back to school? It varies for every child.
Thank you.
All right. So I'm gonna give Mom, Paula, if you want to, if there's anything else you would want to say or hand out to this group, I want to invite you to either say, nope, I said everything I wanted to say, or if there was anything on your mind, you're like, you know what, I'd really like to share this before we go.
No, that was it from me.
Yes. Well, thank you. You gave a very good insight. It's so lovely to hear lived experience, and when you're coming from the outside, you know, like to support. Hearing all the voices matters a lot. So thank you so much for being here. For Mary and Andy, was there anything else that you wanted to, that was on top of your mind? You're like, I'd like to share this out before we go.
Just thanks for the opportunity. Sorry I was a little late, but that was good. Yeah, it's great.
Yeah, thank you. It's always a learning curve, but when the goal is to have kids, you know, grow and learn and do better, we're just very open to things we maybe haven't thought of before. I mean, it's just more of an opportunity to say, we have to try and see if it's the best fit for them. And like Andy said earlier, certainly sometimes we find it's not, but it's worth exploring for sure.
Well, thank you. Thank you all for participating and helping us out and gaining a better knowledge of different ways to interact between service providers and family, and how we can navigate that world. I want to, hopefully Christy can throw in the chat, invite everybody to take some of the time before you leave to fill out our survey around our event today. But I want you all to know that we are very thankful for you to joining us. We are, as part of the COP, and somebody who's been in for not the 13 years since it's been there, but for a while, I thoroughly enjoy these times together and the things that we can learn, and the fact that you can't hear all the voices sometimes from your work experience or your family experience, because a lot of times it's not a good learning time for you when we're hearing all the voices. So it's such a good time to meet and gather and see all the different perspectives, and to be able to take them in times that we can take the learning in. So I want to thank you guys, folks, for so much for joining us for the COP this time. Hopefully you'll see us again in fall. Fill out the survey so we know what's going right and what's going wrong, and where you guys are all showing up to join us from. And we will see you again. If there's anybody who has any questions, I know me and Tim will probably stay on until everybody has taken their little screen off and is all done. But if anybody has any questions for us, we'll stay on for a minute. But otherwise, have a good rest of the day. Thanks for joining us, and share out anything you got today, and take an action item if you can. All right, so have a good one.